Thank you for watching On Call for All Kids. Today we're talking about pink eye. We'll be discussing the various causes of pink eye, the differences between a viral and bacterial infection, and how to know when pink eyes are allergy related. I am joined by Dr. Patrick Molaroni. He's an emergency medicine physician at Johns Hopkins All Children's Hospital. Great to have you, Dr. Molaroni.
Hi, Ashley.
So, what is pink eye and what causes it?
Pink eye is one of those things in medicine that's exactly what it sounds like. It is a pink or red eye, but in medical terms, we call it conjunctivitis. And it's a very concerning thing because obviously, when you look at somebody and you look at their eyes, the redness on the white background really stands out. But it's just like any inflammation that can happen on the body, anywhere in the body or on the skin. So the pink eye is actually a symptom, but what causes it is the difficult part. Pink eye can be caused by an infection, definitely. It can be caused by a virus or a bacteria. It can be caused by allergies. It could be caused by an irritation or an irritant or a foreign body in the eye. And it can also be caused by trauma to the eye.
You mentioned, an injury or irritants getting in the eye. Can you tell us about this type of pink or red eye?
Well, it's really, really painful when a child has an irritant or some type of foreign body in the eye. And that's going to be the hallmark of that for a parent. When we think about an infection, that usually comes on over a period of time. But if a child gets a foreign body or some type of irritant or gets poked in the eye, then they're going to have pain almost immediately. Then the red eye will happen later. One of the things as a parent you would see if you didn't see the injury happen is the child's not going to want to open their eye. Often when there's an irritation to the front of the eye is very sensitive, so they're not going to want to open the eye. It can happen from pretty much anything. As an ER doctor, I've seen dirt in the eye, I've seen sawdust in the eye, I've seen small pieces of metal get into the eye. So any small substance that lands in the eye is going to be an irritant. And then also if you got poked in the eye or any trauma to the eye, anything that causes a cut over the surface of that eye is going to be extremely painful before the child develops a red eye. The second thing is that child's not going to want to open that eye. So if you have a child that has an acute onset of pain and doesn't want to open the eye, that's something that you should be worried about and you should see a doctor that day.
Let's talk about infections. So, do we know if there's a bacterial or viral infection? How do we know the difference?
Well, for parents, it's very difficult, and it's actually very difficult for doctors as well. There are some slight differences between a virus or a bacterial infection of the eye. And most of us know that when you have a bacterial infection, that's something that we can treat with antibiotics. But a viral infection, like the common cold, often you don't have anything to treat that with. So when you have a virus and you'll have other generalized symptoms, runny nose, cough, child sick, and then they develop red eyes, but it's usually both eyes becoming red at the same time. That compared to a bacterial infection or a bacterial pink eye, usually it starts out with one eye that's infected or one eye that's much worse than the other. And as the child rubs that eye, they infect the other eye. The difficulty in here comes in with that sometimes when a child gets a bacterial pink eye, that actually happens after they've caught a virus. And the reason for that is that all day long, your eye is bathed with mucus and tears that come from the outside of the eye and drain at the inside of the eye. When a child is really congested and they can't breathe through their nose, that drainage system kind of breaks down and doesn't work as well. And that actually sets you up for a bacterial pink eye. So as a parent, if you're taking care of a child and they're sick and they have a very red eye, that's something that you should probably schedule an appointment to see the pediatrician about.
And finally, let's talk about allergies. So, if you have a child who has itchy pink red eyes, is there anything parents can do to help their child out?
Well, that's right, Ashley. Allergies can definitely cause red eyes. And for parents, it's most important to know your child. Here in Florida, we're very fortunate. We have beautiful trees and plants all over the place, and we have great weather year round. But unfortunately, those trees and plants bloom at different times. So it seems like we have pollen all year round. And most often, kids who are allergic to things will be allergic during one season more so than the other seasons. At least those fortunate enough to not have allergies year round, they'll have it maybe one season. So as a parent, you have to be ready for that. And if your child ends up with a runny nose or sneezing or red eyes every spring, you need to be ready and have them on their medication for that. If you have generalized symptoms, going on an oral antihistamine or an oral medication that's for allergies might work to handle the generalized symptoms. But some people just get redness in the eyes. And now we do have some pretty good eye drops that can be used for allergies as well. This is something that you should probably come up with a plan with your pediatrician to be ready for it when the allergy season comes on for your child, so you can make them more comfortable so that they don't have those red, itchy, painful eyes.
All right, Dr. Mulroney, thank you so much for joining us today and telling us all about pink eyes.
Thank you, Ashley.
And thank you all for watching. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. There you'll find a lot of great topics in pediatric healthcare and other wonderful resources for your family. We'll see you next time.